Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Hi, I'm Caitlin Tivnan. Thanks for watching Health Watch presented by UMass Memorial Healthcare. So I wanted to ask the doctors, when it comes to exercise, a few important points, like how much is too much, how much is enough so that it actually counts, and of course, what's the difference when it comes to walking versus jogging? Sort of common knowledge that exercise is something that we encourage people to do, but how much is too much and how much do we actually need if there is such a thing?
That's a great question. So in general, moderation is a good thing. So there are very, very, very few people who need to worry about having too much exercise. And there's some interesting theoretical concerns about that, but practically the biggest issue is that most people in America are not exercising enough. So what I say to people is that anything that you're doing now could be improved upon a little bit. So if you're sitting on the couch all day watching television, then just try to get up and walk during the commercials. If you're a little more ambitious than that, then get out and walk 10 minutes every day and then just kind of increase it as best you can. So there's some talk that maybe just 30 minutes a day is good or enough. 60 minutes a day is probably about as much as anybody needs.
So while doctors say getting up and getting active is the most important part, I'm wondering, is it more about how much activity you're doing or how long you're doing that activity for?
For most people, they just need to be more active, and so I don't even worry about, target heart rate. As you get more ambitious in your exercise, then getting your heart rate up into a target zone is more important in terms of building stamina. But in terms of most people's general health, walking is probably just fine.
There are a lot of different opinions when it comes to walking versus running. So the real question is one really better for you than the other?
Walking is just fine to consider it exercise. If you can do something more vigorous like running and your joints and the rest of your body tolerates that, then that's even better.
And does it matter how much, how long?
Again, more, a little bit more is generally good. So if you're doing nothing, then you can run 10 minutes a day, 20 minutes a day, that's great. If you can get it up to 45 minutes or an hour, then there's evidence to suggest that you get incremental benefit at least up to an hour.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.